In the meantime, let's bring you this discussion. South Africa's fight against HIV and AIDS might be in jeopardy after the US President Donald Trump froze funding for emergency AIDS relief known as PEPFAR. It's been operating years since 2004 and is funding more than 1,000 community-based organizations providing a range of HIV and TB services. What does this all mean? Let's unpack this with Professor Shabir Madhi, who's the Dean of Health Services at Wits University. Prof. Madhi, thanks very much indeed for joining us. It's good to talk to you again. I want to begin here, and I know, Prof, that we don't have a lot of clarity on what the next weeks and months will look like in the wake of this decision. But it's clear now, with the closure already of some key clinics posting their notices on their websites, on their social media, and even on their front doors, that they will no longer be operating from today. The impact is already becoming clear.
Good afternoon. Thank you for having me. And just a correction, it's health sciences rather than health services at Wits University. So certainly it is of concern that certain programs have been issued what we refer to as being stop work orders, which means that they shouldn't continue any sort of activity related to the funding of that program in relation to funds received from the US government. But right now, it's not all of the PEPFAR USAID programs that have been affected, but a select few which have been affected, at least in Wits itself.
Oh, so it's not all of the programs that have been affected?
Correct. So there's a number of different grants that have been issued, mainly to non-governmental organizations, as well as to sort of entities that are affiliated to the universities. And of those, there's a select few which have been issued with what we refer to as the stop work orders, which means that no activity can continue in relation to that specific grant. But many of the other activities, including that's funded by PEPFAR as well as USAID, some of those activities are ongoing.
And do you think that will change, given what the US president has decided, Prof. Madhi?
Each day is being updated in terms of which of the programs can continue and which programs should sort of cease activity, or which programs can at least continue within the framework of the current grant conditions. So there's new stop work orders that are being issued on a daily basis. But fortunately, up until now, it is really the minority of the programs that have been affected, and we are hoping that that remains the case. These programs that have been affected, they are undergoing review, and whether they would continue or be cancelled moving forward, that will only be determined in the course of the next 2.5 months.
So how many patients would you say, Prof, if you have that information, how many patients would have been impacted by this stop work notice?
Yes, so it's a really difficult measure to quantify. So the majority of the activities that are funded by PEPFAR as well as USAID is sort of complementing what is already happening in public healthcare services. So there is sort of an alternate or that those individuals would be able to access care, but there are certain specialized clinics which sort of provides care to a specific demographic of individual. As an example, one of the programs that has been issued with a stop work order is the transgender clinic in Hillbrow. And that clinic itself caters for a specific demographic of individuals, but the numbers are not that large. But at the same time, I think importantly is that those individuals should still be able to access at least treatment in public healthcare facilities, but there's other components to their care which might not be as readily available in public healthcare facilities.
Yeah, I see the notice from Wits is that the service will be closing by 4 o'clock today, I understand it. And then after that, people who need help can go to their local clinic with their clinic card for assistance. I mean, Prof, is it overstating it that the fear will be that this halt in aid for key treatments like TB and HIV might hold back some of the progress we've made, particularly in fighting new infections and bringing down our infection tally here in South Africa overall?
Absolutely. So I think what we need to understand is that about 1/5 of the HIV-Aids program in South Africa is funded by this USAID PEPFAR type of grants. So 20% of it is funded by those grants. The majority of the program is funded by the South African government. And what it would require for us not to have sort of a reversal of the gains which have been achieved in terms of the number of HIV-infected individuals on treatment, the reduction in transmission, as well as almost the absence of mother-to-child transmission of HIV, is that we would need to ensure that those programs remain intact, which means that government would need to step in to fill that gap which might arise, both in terms of procurement of HIV treatment as well as in terms of additional human resources to ensure that there's ongoing functionality in healthcare facilities where many of these US-funded staff have actually been integrated into.
Yeah, but I mean, 20% is still 20%, Prof. Madhi, in the wake of budget cuts in healthcare.
Absolutely. I mean, I think the tally is roughly about 6.5 billion rand per annum. Which would need to be raised, which is a significant amount. And yes, at the end of the day, I think the costs related to what would result if we don't actually have government or some other entity step in as a stopgap measure, that cost will be much greater. So it is a large sum, number of competing priorities in South Africa. But at the same time, I think we're going to need to have Treasury and National Department of Health have the discussions that will ensure that there's some sort of safeguarding of what has been really a successful program that's been built up over the past 2 decades.